This is a little bit about what we will talk about today. An introduction, background, some brief demographics. We'll talk a little bit about some barriers to well-being, assets and opportunities in the community, current projects and initiatives, and what this could look like moving forward in 10, 20 years. So hi, I'm Allie Robinson. I'm a community health specialist with Whatcom County Health and Community Services. This is me and my dog Osa. We live and work in East County, and my role has been in the past really focused on community capacity building, understanding community health needs, concerns, and assets, and then community health improvement planning, really embedded and led by the community, and a goal being to focus and prioritize community identified concerns, building relationships and connections with providers, and bringing services and bridging gaps to meet community identified needs. So what is East County? When we refer to East County, we really mean the Mount Baker School District. So this is a map of the, these are the census designated places in Whatcom County. And so in East County, you have Deming, Acme, Peaceful Valley, Kendall is that little yellow bit, Maple Falls, and Glacier. And this is kind of the line, very rough. Obviously, that's not how our maps work, but just to give you a little idea of what this looks like for how we define East County. And this is a short video just outlining not only the remoteness of East County, but also the areas of population. So I focus in on Kendall in particular because of the density of Kendall. It really is quite an urban area. It is an urban growth area, and homes are very close together. And there are a lot of urban issues, neighbor concerns, other things that are harder to manage because of the distance to services. Along with that, we also consider some demographics. And so that is a population of roughly 15,000 in the Mount Baker School District catchment area. And about 3,800 of that is in the urban growth area. 52.8% of students receive free and reduced lunch. And we use free and reduced lunch to kind of understand families and poverty level of families. So it is just a proxy measure for understanding that. So roughly half of families in the Mount Baker School District are eligible for free and reduced lunch services, which means they may be a little bit lower income. The urban growth area has historically been an area of lower income. It's quite affordable place to live in Whatcom County. You know, we've all noticed the lack of affordable housing in the county. And Kendall and Columbia Valley urban growth area remains decently affordable for many folks. So you have families that maybe wouldn't be able to purchase a home in Bellingham, move out to the county so they're able to own a home. Historically, the urban growth area has been a vacation rental community. So over time, those vacation rentals have turned into more permanent housing options. So this is a tool that we use to kind of better understand a community as well. Definitely doesn't tell the whole story, but does give us an idea. It populates from many different metrics and measures from different sources. So it maps out health disparities, and that's you have social determinants, economic determinants, and poor health outcomes. And the darker purple you see in this map, really the more challenging it is in those communities, and the more barriers to care they may be. Um, and this is just a tool to understand kind of the community context and what's being experienced there. As you can see in this area, the population trend, it just continues to increase. And this is in 2018. So obviously we've had quite a bit of population growth in the last 6 years as well. This just gives us an idea as well to what impacts our health. So the health disparities and social determinants take into things, different considerations like poverty level, disability, folks living on a fixed income, that kind of thing. And this is the population health framework that outlines the different factors and conditions that come together to really make someone healthy or unhealthy. So, like I mentioned, East County is a lot more affordable than much of the rest of the county, and therefore it does have a higher proportion of individuals with lower income. Opportunities for homeownership at affordable prices are greater. And then I did mention historically some parts of the region were second homes or vacation homes, and they began to transition to full-time homes because they were a little bit more affordable. Ultimately, the community really wasn't set up for that, but it has been kind of developed, especially with the East Whatcom Regional Resource Center, to create some supports for folks living in the region. There's still not a close grocery store, so access to healthy and affordable food is really hard. Um, Physical activity is difficult. There's not many sidewalks. You have a highway running through most of the community. Um, the playground, the closest playground for folks in the urban growth area is at the Kendall Elementary School, which can be hard to get to for some folks if they don't have transportation, that kind of thing. So I'll talk a little bit about barriers to well-being in the community. One thing I do want to mention is about food security. So the Census Tract 101, which roughly aligns with the Mount Baker School District, is a designated food desert. So accessing healthy and affordable food is really challenging for folks, especially if you're on a limited income, or don't have a vehicle, that kind of thing. I mean, throughout the whole county, grocery prices have increased, so that hits our lowest income community members even harder than others. Uh, Usage at the food bank has almost doubled since 2021 and serving 350 households each week or more, and that just continues to rise. Each week we see a few more households visiting the food bank. And then medical and dental care is really hard to access, so there are no medical providers in the district. Students miss a lot of school and parents miss work to bring students to appointments. Oftentimes trip chaining, so if you're going into town, you are going to go grocery shopping and to the dentist and to the doctor's office and try and do all those things at once. Um, for many folks. Some folks do commute there every day, so it's a little different. But um, in general, if kids have to be at school, um, it seems like parents are trying to fit all of those appointments in when they're either not taken out of school or they have to be taken out of school for a long time. It's challenging to get appointments, so our providers in Whatcom County are really busy and they're booked. So we've heard that it's been difficult for parents to get appointments for their kids, and it's been 3 to 6 months out until they can get in. Care is expensive, challenges with insurance, so accessing, getting signed up for insurance, making sure your insurance can cover what you need, and few dental providers accept Medicaid. So very few dental providers in Whatcom County accept Medicaid, and therefore many folks are either not receiving care or paying a lot of money to receive dental care. I want to speak a little bit about the assets and opportunities in the district. There are many. So a little history. We started providing COVID-19 vaccine clinics in Mount Baker School District and throughout the whole county, but really focusing on um, our hardest to reach populations. We knew that the district had a hard time accessing healthcare and vaccines. Um, the Mount Baker School District was our least vaccinated area in the county, and we really wanted to work to bring vaccines and nurses to answer questions into the community to talk with folks. So that started during when vaccines were available. And then the provider that we were working with was Medical Teams International, and they also had an oral health and dental component. And so they started doing dental services at the resource center. And that evolved into dental days at the resource center in Kendall, Maple Falls area. And that has been going on this is the second year, so almost a year and a half now. There's a lot of other programs and initiatives going on at the Resource Center, Diabetes Education and Support Group, and many others. There's also the School-Based Health Center planning. We'll talk a little bit about that. The annual East Whatcom Health Fair, I'll dive into that. Mental health and the co-responder program with Whatcom County Health and Community Services. The Health Equity Zone is a DOH initiative that rural Whatcom County was selected as a Health Equity Zone recipient, and they are focusing resources and supports in this area to work on community initiated and community identified needs. And then also providing vaccine clinics throughout the county in collaboration with community partners to support access to vaccines for children. So this is just an example of a vaccine clinic that we did pop up. This was at the Resource Center, and we did them all throughout East County and then also in Sumas, but we went down to Glen Haven. Glen Haven is part of East County, Deming, Maple Falls, Acme, Everson, and Kendall at the Resource Center. And this is the Dental Days program. So Medical Teams International visits the East Whatcom Regional Resource Center once a month and provides free dental services. The Resource Center is able to coordinate those services and provide reminder calls to patients, and then the medical team that volunteers with Medical Teams International provides the dental services. They're also working with BTC to do hygiene visits as well. Then these are just some photos from the annual East Whatcom Wellness Fair. This is Basil, the food truck from Common Threads. They serve really delicious meals and come out to East Whatcom throughout the summertime to provide summer meals for students and families. The digital equity bus was there. There was a blood drive. We had 17 folks that gave blood. And this is the VSP Vision bus that was able to join us, and they do vision assessments and provide glasses to folks um, who have appointments for the day. So it's really cool. They make the glasses right on that bus, and everything's all in-house. And there were some therapy llamas. And
So there are a lot of behavioral health needs in the community as well. Whatcom County Health and Community Services does have a co-responder program, and this program goes out with sheriff's deputies to 911 calls that are non-life threatening, non-violent, and may just, there's a thought that that individual may need behavioral health support. And so this program is really about supporting folks in immediate crisis, and they are able to talk to a mental health professional and get services they need and potentially be transported into a behavioral health treatment center, or determine what other needs they may want to access. And then there are multiple mental health counselors at the Mount Baker schools. So CMAR and Compass Health both provide mental health support at Mount Baker schools, but more is definitely needed. We found that when we did our school-based health center planning work, that the mental health needs and challenges to access mental health care were the highest priority of students, staff, and parents of the district. And then also the Mount Baker Community Coalition is an organization that has been working under Whatcom Family and Community Network for many years. And they bring together community partners and leaders and stakeholders working in different areas to support mental health promotion and substance use prevention. This is the Ask a Nurse program. They are under Health Ministries Network, and they are an incredible group of nurses, volunteer nurses, that provide nurse consults on a regular basis during Foothills Food Bank hours. So they see clients, talk to them about blood pressure, diabetes management and care, all sorts of things that someone would need or want to talk to a nurse about. They are available to consult with folks, and they've built really strong relationships with community members, many of who may lack trust in the healthcare system. They've been able to provide follow-up support and offer connections and referrals to care in the community as well. And they're working on building out this program for different areas of the county as well. So rural health, the Health Equity Zone initiative is a new initiative from State Department of Health. And this bill created a foundation to create a health equity zone. And there are 2 zones throughout the state, actually 3 zones. So a rural zone, an urban zone, and a tribal zone. And Eastern Whatcom County is and rural Whatcom County is the rural zone. So a group of individuals applied. We actually had, I think, 3 or 4 different applicants apply on behalf of rural Whatcom County and East County to be a health equity zone. And it's a geographic region that really has challenges and barriers to care, and really some of those social and economic challenges to accessing care. And the goal is to impact the community conditions that influence our well-being. And so me in partnership with many other organizations, including Trucknut Health Foundation, they are the holder of this program, are working to kind of build community capacity to bring people together to identify kind of what does the community want to see with some of this funding. So there's I think $200,000 for multiple years to invest in the community to actually make change. So this is a really neat program, and East Whatcom County and rural Whatcom County is really lucky to be kind of part of this, and we're really excited to see what this looks like moving forward. So I'll talk mostly here about school-based health centers. This is where the bulk of my work is. And just a little background, school-based health centers are student-focused centers located in or adjacent to a school where students can receive integrated medical, mental health, and other healthcare services. So they're really a collaboration between the community, the school, and a healthcare sponsor, and they serve all students regardless of insurance status or ability to pay. So they are scientifically supported to improve student access to care, improve health outcomes, and educational achievement. Ultimately, for Mount Baker, this means students won't have to miss full school days to receive one medical appointment. We heard a lot through our needs assessment process that families were taking kids out of school just for the whole entire day because that's how they could access care, and they maybe stacked their appointments to do them all in one day, or just didn't see the need to bring their kiddo back to school if there's only an hour left and they get home at 1 o'clock or something. So this is funded by the state. So it's House Bill 1225 and a new law. And these grant funds opened in 2020, which these grant funds opened in 2020, and Mount Baker School District, because of the relationships we had built in the past, we were able to apply for this grant. I supported the application for Mount Baker School District, just knowing kind of my understanding of the community context and also the needs of the community. We really felt like Mount Baker would be a really strong recipient of these funds, and we actually ended up getting that grant. So in 2020, Mount Baker School District received the planning grant. And our planning activities included building out the Healthy Baker Advisory Committee, which is a group of individuals, school administration, parents, community members, nursing staff, both current district nursing staff, previous nursing staff, and medical providers to kind of plan for what a school-based health center looks like. We also did a lot of learning. We visited a lot of schools. So Cedar-Woolley has a school-based health center that is run by Peace Health. That's at Cedar-Woolley High School. So we went and visited their clinic, learned from there what they were doing well, what they had learned through their process, and what we needed to think about as we were starting this. We did conduct a needs assessment. So that looked at student, parent, and staff kind of understanding of needs, what they felt the students' health issues were, and what they really wanted to focus on, and what was important to them. And really that found that mental health had a strong need. So students found it really hard to access mental health and counseling and support. And so that is a real big focus of our work. And then parents had a hard time getting students to appointments. So that's either the travel time was too hard, they had to take time off work, which was really challenging or not possible, and or appointments were just scheduled too far out that it wasn't applicable anymore or wasn't needed anymore. And then we also there were questions during this time. So many justified questions about, what services will be available? Who will the clinic serve? And some of those were particular to reproductive health care or providers seeing youth without consent. And we're really starting this program, which I'll talk about implementation, but we're really starting this program with sports physicals, behavioral health referrals if needed to kind of existing mental health providers, and well child checks. So really starting phase one with basic care. We want kids to be able to play sports. We want them to get their physicals and their well child checks, and then expanding the program in years to come. So throughout this planning year, we also created some medical provider partnership. Like I said earlier, our providers are really kind of undergoing a lot of stress after the pandemic. There's a lot of workforce challenges. And so it was really hard to find a provider that was willing to support this work. Um, and through that, we also created a business plan, a proposal and sustainability plan, and then ongoing student and community engagement through that. We also visited, so Lummi Nation has a school-based health center. The Lummi Tribal Clinic has a provider, a pediatrician on site at the school, and we visited and spoke with their provider as well to learn about their program. And right now we're moving forward with implementation. So again, this is a phased approach. We're really starting with basic care to begin with. And the school is working with CMAR Community Health Centers to build out that program. So a site in the school has been identified. We are working to receive some funds from the state to modify and renovate that space so it can accommodate a provider. And then beginning tentatively August of 24, that provider will be on site to see students and do those sports physicals. We selected August because that's right before the fall sports season. So with the goal that this provider can see students and get them able to play sports in a timely manner. There have definitely been challenges throughout this process. So providers are tapped. Like I said, the workforce is really struggling, and many were unwilling to even consider kind of opening a new site. Really, we are building a new clinic, and so that was quite challenging. And it's a really complicated system. However, it's not a new system. So there are many school-based health centers, over 70 school-based health centers in Washington state and hundreds throughout the country and in all political landscapes. So not every state, but many states have school-based health centers. And it's really because they are scientifically proven to support student well-being. They do not see students without consent. They will in Washington state follow minor consent laws, but for most services, parental consent is required. And parents are welcome and able to be at those appointments or talk on the phone with the provider. Really, it's not designed to not include the parent. It's really designed to limit learning loss of the student and provide that care in a timely manner so students can get back into the classroom. These are just a few of the many providers and support partners that have been involved in the different initiatives. This in no way encompasses all of them, but there have been so many individuals, organizations that have begun and continued working in the region that really are building out these programs and trying to find sustainable solutions for getting access and support services to folks in East County that have a harder time receiving and reaching those services. So moving forward, some of the things that I think about when we're looking at 5 or 10 years down the line, I really think about school-based health center expansion of services and the scope. When we were conducting the needs assessment, and just from what I know about the community and our community partners know, really the access to care challenges are moved beyond students, families and their parents have challenges accessing care, and our older adults and veterans have challenges accessing care. So really, we wanted to design a school-based health center at Mount Baker that could be accessible to the entire community. We're really trying to figure out what that could look like in a safe way so that students can feel safe when they're going into the clinic and have designated time. And we can also see some of the older adults or the aging population in the region that may also need to seek providers and seek care. Um, and then also there's so much opportunity in Whatcom County for that program to expand to different school districts. I think a lot about Nooksack and the Sumas region and how that is also an area of high need, and how we could start to kind of work with that school district or the providers there to see what that could look like. And then sustainability and funding is always a challenge. And then staffing and workforce development as well. Really encouraging and creating systems that host strong workforce, and working with the organizations that train and support the workforce so we can ensure that those individuals stick around, and that really helps to build trust within the network and within the community. And just increase service availability in the region. A lot of the programs that I mentioned were really stopgap measures by nonprofits to meet the needs of the community, whereas a sustainable solution would be a medical provider or someone else in the region that is able to bill insurance and able to really see folks on a consistent level and a consistent fashion. Really, the volunteer-based work, it's not always sustainable. So really creating a model that can welcome that more sustainable fashion that has either a brick and mortar or a strong paid mobile or portable model that can meet the needs of families and the community members there. And also just continue to support and build on the work to address the underlying conditions. So we're doing a lot of work on that population health framework around environmental health and well-being, food access, other things that really influence our health to create and generations a community that is well and healthy and can meet the needs of its families and students and aging population, veterans. So. And that is all I have for you. I would be happy to stay on and have answer questions. This is my contact information. Feel free to send me an email or give me a call. And I really appreciate your time.
Thank you very much for that. That was very informative. These are the kinds of things I suspected were going on in the eastern part of the county. And I was actually surprised to find that I'm part of it because I'm not far from Glen Haven. I'm in the Mount Baker School District. Didn't realize that. I have the advantage of being much closer to I-5 and so easier to access many of these services. Are there questions? If people could either raise their hand if their video is on, or perhaps put the question in the chat, or there's a raise your hand function. Okay. I just see one. Oh, Lisa, go ahead.
Thank you. Hey, Allie, I'm curious, with the school-based health center, you mentioned that all students would be able to access services, but what I'm curious about is, will insurance be billed for those that have it, or is it not going to be billed across the board?
Yeah, to ensure sustainability for that program, insurance really does need to be billed just because the funding we have won't last forever. So that would be the kind of business model, is to bill insurance if students have it. With that, there are challenges because some students and families may get that explanation of benefits and the parent might not realize they're accessing care. And so there could be some conversation there too, that we've talked about. But we want parents to be involved, and we do ask those parents in the form of for insurance information. So that will be part of the model.
What types of insurance are most prevalent in the eastern part of the county? Is that Medicaid, or what is the mix of insurance?
Yeah, that's a good question. I don't think we have great data about that. We do have some data about Medicaid types. There is quite a bit of Medicaid. We really use that measure of free and reduced lunch to kind of understand kind of where folks and families may fall along the poverty line. But I think it's a mix. It's really a mix of private insurance and Medicaid, VA benefits, that kind of thing.
Okay. Shamika, I see your hand up.
Hi, Allie. The question I had, I'm just curious about I guess this would be more demographic information. I'm thinking and wondering, in the Eastern County, are there a higher concentration of refugees and immigrants, or migrant workers as well, farm workers? Is that a significant population in that county?
Yeah, that's a really good question. We do see an increased rate of Latinx folks, farm workers, and then also kind of Russian, Ukrainian, Eastern European families and communities. So I would say it's really challenging to measure that demographically, because on most of our kind of census surveys, it doesn't ask those questions. It really asks race, ethnicity, and kind of not country of origin, or even language spoken at home sometimes isn't asked. So there's no good measurement really for some of that, but it is estimated that I think roughly 20 to 25% of folks living in the urban growth area are Eastern European or kind of within that community.
Donna.
Yes, I suppose that you're looking for a sustainable program, and I'm wondering, you hadn't mentioned, I don't believe, about grant writing and who's doing that, and if they're college students, or how you could get more grant writing possibilities.
Yeah, that's a great idea. I mean, I think that the grant opportunities and grant writing a lot of them are collective efforts for whenever they come up. So for the school-based health center grant, I wrote that on behalf of the school district. Another thing that we run into is not only do providers lack capacity, but our school districts are consistently overworked and overtapped for their resources. So that is kind of why I have had to step in and support the planning and implementation of that program, the school-based health center program there. But we do have interns often from colleges throughout the region of Western, but we haven't implemented. I would say it's maybe dependent on organization. So the Opportunity Council writes a lot of grants. They have grant writers on staff, I think, to do that. And then also just the relationships that are built from other organizations and funders to meet needs. That's kind of where the health fair came about, is we had relationships, and funders such as Peace Health said, well, we'll provide 20,000 for the first year for this event, and then move on from there. So I would say it's variable. A lot of folks write the grants, and there's no one consistent East County grant writer.
I saw some questions in the chat here.
Thank you.
And the first one is, could you discuss the ways in which the Chuckanut Health Foundation is involved? You mentioned them.
Yeah, so they are supporting the health equity zone work. They do a lot of other things in the community, but one of the primary ways is the health equity zone work. They're kind of the lead on that. The health equity zone initiative was interesting, where anyone could submit a proposal for their region. So East Whatcom County and rural Whatcom County had about 3 proposals, and Chuckanut Health did submit one of those, as did I on behalf of a large cohort of organizations. So we have decided to work together to build out that model and what that looks like. So they're kind of focusing and organizing that work, which has been really helpful because a lot of folks working in East County do have a lot on their plate. And so they've added some capacity there, which has been wonderful.
And then another question: is there a patient feedback mechanism to collect and compare data before and after the student health center opening, to measure satisfaction and ideas for improvement?
Yeah, that's a really good question. Because the funding for the school-based health center comes from the state of Washington, there are requirements for that data to be collected, and also data about who the school-based health center is reaching. Is it really reaching the students and individuals that it needs to reach, and how it can improve. So, and I think part of that will be, really our goal is to create a student leadership committee as well with that, so they can be the owners of this health center and really design it and have it meet their needs as they say they want. I know I've been out of high school for quite some time, so I definitely couldn't put something together that would be appropriate for students like they could themselves. So really relying on that student voice is essential.
It kind of related to that, do you have a relationship with any of the local legislators, either at the state level or local level, who are championing some of this that you're doing?
Yeah, that's a good question. I would say I don't necessarily have relationships, but I know our department director does. That is definitely part of her role and our management role to kind of work to get funding and advocacy in the state and county to accept and kind of broaden the availability of funding for some of this work. And also, as a public employee, there are legal limits to what I am able to do in terms of advocacy.
If you keep us informed of your needs and what you would like, that's one of the things the league does, is as I advocate for certain issues of public policy, and the kinds of things you're talking about are consistent with our positions. There'd be no difficulty there. There's another comment and question in here. I want to thank you for your outstanding presentation. And the person noticed that you collaborate with Common Threads, and actually we visited one of their sites in Bellingham maybe 2 or 3 years ago. But they just learned that Common Threads got some bad news. There's about $675,000 grant did not come through. Do you have any idea how this might affect your program going forward? Will it affect it?
Yeah, I'm really sorry to hear that. I didn't know that happened. Unfortunately, that is the nature of grant writing. Sometimes you don't get the grants. Hopefully it won't impact their programming too much, but I would say it just means they will have to seek funding from different sources, and hopefully it won't kind of pull them out of schools, because the work they do in schools is so vital. So I don't know exactly what this grant was for, but hopefully they can maintain programming at its current level. But yeah, that is unfortunate.
Okay. I don't see any other questions in the chat. If I've missed any, someone wave their hand or yell or scream or something. If
John Scanlon has his hand up, Mary Lynn.
Oh, I'm sorry. Who is that? Who has their hand up?
John
John.
Scanlon.
Sorry, John. Go ahead.
Hi, Mary Lynn. I was being a little cheeky in the chat. I said hi when the question about legislators came up. For folks who don't know me, I'm John Scanlon. I'm a Whatcom County Council member. I was elected last year, started in January, and I chair Whatcom County's Public Works and Health Committee. And that's one of the reasons why I'm here, just to listen in and hear about all the great work that's going on. I sat next to some folks from the health department about 2 weeks ago at an event in Kendall, where the community came together with the Foothills Community Alliance, where the community documented some of the needs, including healthcare needs in the community and broader public health needs. And it was great to see such a big delegation from the health department there at that event responding to community needs. So Allie, thank you so much for the presentation today. I was wondering, this is something that was a big motivator for me to run, the healthcare disparities in our county and looking at some different ideas for us. And I was curious to know, through some of the work that you do you ever partner with the United General Hospital District in Cedar-Woolley? I know the county is partnering with them on a few items with some contracts, and I'm wondering, as this work goes forward, if you're partnering with them on any of these initiatives.
Yeah, that's a really good question. I haven't worked directly with United General, so I definitely see that could be a benefit moving forward when they serve an equally or maybe even more rural community. And so I think we could learn a lot and figure out kind of what things could look like moving forward.
Thanks.
Okay, I don't see any other questions. Yes, and please alert me if I missed anybody. I don't mean to do that. Oh, I do see another message here. Oh, it's thank you for a great presentation and for your work on the county council. I thank Allie and thank John for this work on John Scanlon for his work on the county council. Yes, we appreciate that very much so. Okay.
I just posted my email and phone number in the chat if anyone wants to reach out.
Great idea. And if you don't copy the chat or lose the chat, you can always contact me, and I have that information here, and I will pass it on to you. Okay. I want to let you know how much we appreciate your talking to us today, informing us. I think we all learned a lot about our neighbors to the east of us. Thank you very much. Well, I'll get on with the business part of the meeting. And you can say if you want, if you're interested in that, or this is your excuse to leave if you feel like it. But thank you very much. Okay. I wanted to update people, about what's going on, what's going to be happening. Our next healthcare issues meeting is going to be Monday, June 17th, again at 10 o'clock as usual. Although this meeting is going to be in person, no Zoom calls. We're actually going to talk to live, real people and meet there. The location is to be determined. It'll be a place where we can have coffee and snacks, or we simply won't hold a meeting unless we can do that. But yes, so I will get that information to you very soon at the location, but mark that on your calendars, Monday, June 17th at 10 o'clock. And we'll all get together and actually get to talk to each other, get to know each other more. And then in July, there will not be a regular healthcare team meeting. Instead, the healthcare team is partnering with Whole Washington to host a healthcare town hall on July 13th. That's a Saturday. It'll be at the lecture room in the Bellingham Central Library. I think will be very interesting. Whole Washington is an organization that is promoting universal single-payer healthcare in Washington State. And there will be a brief press. I went to one that they did a couple of weeks ago, and there was a brief presentation. But mostly, they want it to be interactive. They want it to be a dialogue. To learn about the particular healthcare problems in this area that people are facing, and then talk about some of the general healthcare problems that are across the state. So I think that will be an excellent resource, and I'm hoping that it will not be just the healthcare team, because that would be kind of like talking to the choir. We all know quite a bit about healthcare issues and problems, but it will be a community event, and as a result, I'm looking for volunteers to help make that happen. What I'm seeing now is we'll need a couple of people to kind of act as hosts of the meeting, perhaps pass a microphone along, or answer some questions or something like that. Just a couple of people to kind of serve as hosts. But then more than that, we're going to need people to publicize the event. It would be nice if there was a small group that could get together to brainstorm ideas of where would be the best place to publicize it, how to go about that. Public locations where posters should be put up, press alerts, things like of that nature. And then then people who will bring the posters or flyers, whatever we come up with, to particular locations. Maybe the local Starbucks or the grocery store, or the places we think that might be frequented by the community, and so that we get a broad section of the community attending this meeting. So I will send out an email very shortly with that information. And yes, I'm going to be asking for your help with that. Okay. Does anyone else have anything that they want to announce, or things that they're doing, or organizations that are doing things, or anything else that's going on with them or the community? Okay, I'm not seeing any hands raised. Okay, so with that, I will end the meeting, and watch for your email. It'll be coming. Thank you. Thanks for coming today. Bye.